Hello, and welcome to week 2. When we met last week, we discussed a historical overview of nursing. We noticed that as societies changed throughout time, that so did the profession of nursing. Today, what we're going to do is we're going to look at how these changes have helped to give rise to different healthcare organizations. We're also going to review some of the barriers that patients now face in trying to get healthcare due to the economic impact. And these are some of the things that BSN should really understand. So we'll begin with a mention of some of the societal changes. According to Blaze and Hayes, changes in healthcare delivery has had an effect on nursing practice. We mentioned that much of nursing was performed in the home when it first began. In 1900, there were home visits. However, as technology evolved, nurses became better educated. Hospitals became the mainstay of care delivery. During the period of 1970 and 1980, nursing care became specialized, and nurses also became more autonomous. Although all these are excellent qualities, what's taken place is that they have created or helped to create or added to some of the barriers to prevent healthcare for some patients. One is that there's a demand versus supply issue. In 1980, the cost of medical care increased faster than the gross national product. In 2009, the gross domestic product was 18%, which equates to about $2.6 trillion. Blaze and Hayes estimate that by 2017, it will reach almost 20%. So demand for expensive care has outstripped the ability of payers to pay and is spiraling out of control. Prior to the Health Care Bill Act that passed last year, the United States is the only industrialized nation without a national health care policy. If you think about it, in 1965, Medicare and Medicaid was one, but it was mainly for poor and the elderly. So some of the barriers that are taking place today is due to that cost. The Congressional Budget Office stated that the uninsured has increased from 45 million, and they expect it to increase to 54 million by 2019. There's lack of insurance. Insurance cost has increased. Sometimes people have problems with insurance because they sometimes are dropped from their policies. So there's difficulty getting appointments and difficulty finding services. So these are some of the barriers that patients face. So it brings one to think about, well, should everyone have access to care? Should the poor really be taken care of? And in 2005, the ANA's agenda on healthcare reform stated that access should be affordable, available, and acceptable. And maybe we should think about some of the technology that we use and move back to that community model that we had back in the 1900s, such as having healthcare areas in the churches and mobile units and homeless shelters and workplace and schools, because this would help to control the cost, meaning that we would be shifting from centralized biomedical model to more of a community-based holistic model, and that will be promoting health and wellness and well-being. So let's look at some of these concepts: health, wellness, and well-being. At one time, disease was the benchmark for health. In early medicine, the pathogenesis of disease was the main focus. Today, the salutogenesis is really one of the focuses, and that it refers to health and wellness is our main concern. So as Blaze recorded, according to Health, is in 1860, Nightingale defined health as being well and using every power the individual possesses to their fullest extent. The World Health Organization looked at the concept health and said that it was a state of complete physical, mental, and social well-being, and not merely the absence of disease. In other words, this reflects the concern for the total person and places health in the context of the environment, equates health with productive and a creative living. The President's Commission emphasizes that health is an adaptive process and defined it in terms of role and performance, such as a health role. They feel well. If there's a sick role, the person may be exempt from the usual social tasks, and they're not held responsible for the illnesses. Obligation is to get well, and obligation to seek competent help to treat their illness. The ANA in 1980 defined health as a dynamic state of being in which the development and behavioral potential of an individual is realized to the fullest extent possible. Now let's look at the concepts of wellness and well-being. It states that the wellness and well-being is a process of identifying needs for improvement and making choices that facilitate a higher level of health. Some of those concepts will include self-responsibility, the ultimate goal, dynamic growing process, daily decision-making, whole being of the individuals. So now that we know what health and the well-being means, let's look at what illness and disease, those concepts. Illnesses is a personal state of feeling unhealthy, may or may not be related to the disease, and usually is what the person tells you. A disease is an alteration in body functions resulting in a reduction of capacities or shortening of the normal life.